Hello and welcome to this video on one of the most common and arguably important medications in the world, acetaminophen. Acetaminophen is known as paracetamol or by brand names such as Tylenol and Panadol. But what makes acetaminophen so important is that it is a very low toxicity level, provides pain relief, and is an anti-inflammatory. This makes it a frontline or primary form of treatment for all kinds of pain and fever without the need for a doctor or hospital. This is why the World Health Organization, among other different non-government organizations, considers it an essential medicine. What it does is address things like pain, fever, and to a certain extent can be useful in other respects, although primarily its uses are for fever and pain. In terms of fever, it is, simply put, going to reduce it. However, the exact antipyretic or anti-fever properties of this aren't necessarily as well studied. There are a lot of questions about it, mostly having to do with how effective it is, and certainly by comparison to something like, say, ibuprofen or similar products. The reason that it's used, and particularly why it's prescribed without actually being a prescription, is that it's thought to have at least a reasonable effect on fever. Understand, this is not going to stop you from having a fever entirely, but it's certainly going to help make things at least somewhat better. This is another reason why it's often included in medication, whether over-the-counter or prescription for things like influenza and the common cold, where you'll have a sore throat, stuffy nose, and other similar symptoms of malaise. The effectiveness in that scenario is far more questionable than it is in more general pain and fever. It's established that it can lower the body temperature by about half a degree or less. Now that may not seem like much, but that is enough to generally prevent someone from dying, ideally, or at least make them far more comfortable. Now, if you're seriously ill, to such an extent where fever will kill you, this won't stop it. That's just a reality of the situation. Things have gone way beyond what paracetamol or acetaminophen can do for you. But, for far less significant or serious illnesses, this works fairly well. This is one of the reasons why, for the most part, it's used more for its analgesia or pain relief effect. Now, the pain relief effect does vary considerably by the nature, location, and effectively source of pain. So for example, if you have a headache, this is actually quite a good option. However, if you have sore muscles from, say, running a marathon, it's not going to help anywhere near as much, particularly again by comparison to ibuprofen. It's generally given for the relief of mild to moderate pain, so mild muscle aches, arthritis, headaches, something from, say, a tooth pain. Also to an extent for things like cold, flu, and similar. It's also really only supposed to be used for what's considered acute, that is, only short-term and sudden pain. However, in some instances, it is used for chronic conditions, particularly for things like arthritis, where people will consume it practically daily and for an extended time frame, mostly until they die in the case of arthritis. Musculoskeletal pain is the first of these categories, and again, it's such things as, say, arthritis or backache, muscles that are sore from exercise and similar. It does appear to have at least some small benefit in regards to these, and that's pretty much what you're after. You're really taking the edge off the pain with this, rather than trying to get rid of it entirely. The problem is that for some conditions, such as osteoarthritis, rather than the broader category of arthritis, the evidence to support its use in this respect is rather lacking, mostly down to the fact that the effect is relatively small in most clinical trials, and the clinical trials themselves have been rather questionable in their nature. And therefore, the extensive criticisms and the relatively small effect has most practitioners thinking, does this actually do what we're thinking it does? And again, particularly by comparison to things like ibuprofen, that's a non-steroidal anti-inflammatory. In fact, for a lot of skeletal type pain, acetaminophen is not really recommended, and it's mostly down to the nature of what the pain is. So for example, a lower back pain due to, say, poor lifting practices when doing manual labor, it doesn't have any real benefit, or at least not a benefit that's substantiated by proper clinical trials. In terms of headache, it works very well, and that's mostly down to the fact that you basically have a better chance than not of experiencing relief if you take it. There's about a 20% rate of people getting better with a placebo, and about a 40% rate for those who actually take acetaminophen. So you do have a better chance of feeling better. This improvement gets even better again when it's taken as part of a cocktail, let's say. The cocktail is generally something like aspirin, paracetamol, or acetaminophen, plus caffeine. Now, the mixture of these things is for several reasons, one of which is aspirin helps with the blood flow and therefore delivery of the acetaminophen. Acetaminophen is the active drug, so to say, and caffeine helps with the metabolism and incorporation of it into the cells and therefore the function as a manner of relieving pain. Although this is primarily looking at people with migraines. Headaches it's far more successful with. What distinguishes the cocktail of aspirin, paracetamol, or acetaminophen and caffeine is that it's not a prescription medication and therefore it is a self-remedy of sorts. Understand, self-remedy here is used in very crude terms to refer to something you don't need prescribed to you, and it is recommended by a number of national and international organizations that look at things like headaches, pain, migraines, and so on. Next, we have its effect on your GI tract, and it's actually adverse effects or negative effects from this, mostly because of how people consume it. Now, the most common effects are going to be things like nausea and abdominal pain. Admittedly, they are rare, but they can happen. But then again, with most medication that you take orally, there is a risk of this occurring. And the reason for it is fairly straightforward. It's that the way the body reacts to something being introduced to the stomach is that it starts producing hydrochloric acid to melt down or denature whatever's in there so it can be turned into chyme. From there, it then moves into the small intestine. But with pills being relatively easily meltable, and the body basically going overboard with this, you wind up causing some harm to the stomach, and this leads to ulcerations if done for an extensive time frame. If only in the short term, you get nausea and abdominal pain from trying to digest your own stomach. There are other possible risks. For example, you can get some skin reactions, such as the Stevens-Johnson syndrome, and you can also get some necrolysis possibilities. Understand, rare conditions by far, very rare. The far more pressing and very much more significant concern when we're talking about acetaminophen is that it can be dangerous to the liver, mostly if you take either excessive quantities or if you take it for a prolonged period, or in some instances, take it with too little time between doses, it can cause liver damage, and this can build up to become liver cirrhosis and then eventually liver failure. There is a general trend that the longer you take it for, the more likely you are to experience this. This risk, however, is in some respects comparable to ibuprofen in that it is just as likely to develop other complications with ibuprofen. It's just this is specific to acetaminophen. What is equally comparable between the two are issues around gastrointestinal bleeding, that is, bleeding into your intestines, mostly because of either damage to the intestines becoming extra permeable, or in some instances cell damage from toxicity. The rates are more or less similar and are relatively reversible. There is some concern, particularly very long-term data, around continuing to use acetaminophen for a very long time. Admittedly, most of the data that does exist is of dubious nature, mostly because they're either observational studies, so we don't know exactly whether or not the acetaminophen is the cause, a symptom of, or just a confounding variable. In other instances, the trials have been of not great quality, and as such, you need to raise some pretty big questions about it. There is a better evidence, although not necessarily definitive, proof that acetaminophen can increase the risk of kidney diseases and problems, mostly kidney impairment and kidney cancer. Now, the risk increase isn't necessarily definitive, given it's a meta-analysis, but they're generally more indicative of a problem as the greater data set that's relied on tends to pick up more sensitive results. So there's about a 0.25% increase of kidney impairment and about a 30% increase in kidney cancer. One of the other effects that may be contributing to this is the increase in blood pressure and heart rate. These are concerns that can affect the way blood flows through the kidney and the work the kidney is expected to do. However, all of these problems are fairly mild, if non-existent, so long as you are taking it both at the prescribed or recommended dosages and only in the short term. It's the risk of long-term usage, and often in greater amounts than is meant to be taken, that lead to these problems. This leads us to what happens if and or when someone consumes too much acetaminophen. The general recommended daily maximum intake is going to be somewhere between 3 and 5 grams. This is going to be somewhere between 6 and 10 tablets typically, as most tablets would generally be 500 grams and you would take 2 at a time typically. The general prescribing pattern, let's say, or consumption pattern should be take your initial dose and then wait 4 hours and then take another dose, but no more than roughly 4,000 milligrams or 4 grams in 24 hours. So basically, don't take more than 4 doses a day. This leads us to then what happens if you do exceed that, which does happen for different people in different circumstances. Generally, it's a case of self-deletion. Acetaminophen or paracetamol leads to toxicity in the liver, and often acute liver failure. This is basically the liver just can't keep up with what you've done to it. What happens is that the acetaminophen is cleared out by certain enzymes within the liver. If you don't have those enzymes available, or you've exhausted them by having, say, taken way too much acetaminophen in one dose, your liver is no longer able to deal with it, and so once it enters the cells, it starts building up. And that build-up of acetaminophen leads to the hepatocytes or liver cells getting damaged and eventually dying. If you aren't experiencing acute liver toxicity, the general process for paracetamol absorption, use and then metabolism by the body, and then later excretion is rather straightforward. You generally consume it orally, although there are IV preparations available. It's then absorbed through the small intestine and enters into the bloodstream. Most of the absorption is only going to be the small intestine, and there are negligible amounts that will occur in the mouth and stomach. One of the reasons, as we mentioned earlier, that's recommended to have a, let's say, food or similar, or when you take paracetamol, is to ensure that the stomach emptying is somewhat slowed down and the absorption is somewhat more, not necessarily delayed, but more even across the entire duration. After about 30 minutes, peak plasma concentrations of acetaminophen will occur. Sometimes this can take up to 90 minutes, particularly if you've consumed a large meal, and it's high in carbohydrates as the body slows down the movement of the medication within the digestive tract, and this allows for slightly slower, let's say, absorption through the intestinal wall. At its fastest, it's about 20 minutes, and at its slowest, it's about 1.5 hours. Once it gets to its peak dose, it'll generally hit somewhere around 63% of what you've consumed, and in larger doses, so if you're taking a full 1 gram or 2 tablets, it's about 90%. Over the next 1.5 or so hours to 2.5 or so hours, you're going to begin excreting it, and that will be its half-life. That will mean that roughly every 2.2 hours, your body will halve the amount of it floating around in your bloodstream. Over the course of roughly 4 of those half-lives, you'll have excreted the majority of this, which is another reason why roughly every 4 hours a new dose is acceptable in order to ensure that you don't overdose. The medication itself, acetaminophen, is reasonably soluble in a lot of tissues, along with the ability to excrete it. This is why the amount that's floating around in your bloodstream after your initial half-life period of about 2.2 hours is going to be 30 micrograms, or roughly 200 micromole per liter. At 4 hours, this drops again to about 10 micrograms or 66 micromole a liter. This means that you don't have a lot of it floating around in your plasma or blood at any one time, but it is in tissues. And this ensures that, for example, if you have muscular pain, the relief is already available in that tissue where the pain is. We've mentioned that acetaminophen is a readily available medication, but it's also considered an essential medication. The reason for this is simple enough. It is reasonably easy to make. Understand, reasonably easy in terms of it's not a hugely complex chemical requiring ridiculously complex processes and facilities. It's something that, if for whatever reason you are inclined, you could theoretically make in your standard benchtop laboratory. The general process is you get a p-amantophenol, and this is combined with water and hydrochloric acid. This is then cleaned using charcoal to remove the very dark coloration of what you've produced. That should mean that you now have a crude product called p-aminophenol, and it's also going to contain a lot of polymeric material. This needs to be removed, so the solution has to be continuously moved for about 10 minutes to ensure that the charcoal can react with and take away anything that's coloring the solution. This can then be centrifuged or similar to remove the charcoal along with that colored material, leaving you with a relatively pure product, or at least in terms of it being uncolored. This is then filtered using standard filter paper, and after this, you are left with a solid in that paper. That solid is what you're after. The filtrate is what you're after, so you can then take that away and then put it into storage. At this stage, however, what you should be aware of is that it will be a dark color. We're not talking crude oil kinds of dark where it's black, but rather it's going to be something like a lightish brown, an amber, or a tea color. This is then combined with a buffer solution, and the buffer solution is then combined with your crude product, your filtrate. By combining the two in a steam bath, you're able to create a relatively liquid solution, which can then be further diluted down using acetic anhydride. You then transition it to a cooling ice bath and stir it continuously while the crude acetaminophen begins to crystallize. This should leave you with small crystals at the bottom of your beaker that allow you to then extract these, and you have what is, for all intents and purposes, acetaminophen, just in a very crude but pure state. What you then need to do in order to ensure that the preparation is finalized is to take this, resuspend it in a liquid solution or dissolve it in a liquid solution, but using a specific quantity in it. So for example, if you were making a single tablet, it would be 500 milligrams or half a gram. This is then recrystallized using a very similar process. On a, let's say, physiological level, the acetaminophen is useful because it works through two different mechanisms. The first is the COX pathway, and the other is a product of metabolizing the COX, or not necessarily the COX pathway itself, but after acetaminophen has worked its way through the COX pathway, and that is your N-arachidonylphenylamine pathway. In both respects, it fundamentally has a similar outcome, that is, you interfere with the transmission of the pain relief, and you prevent some of the inflammatory processes that are involved in inflammation, and particularly how the body says that there's damage or problems here. By preventing the chemokines and tactokines that are saying there's damage, there's problems, the body doesn't get the signal saying that pain is happening. And this leads to not just in and of itself the analgesic effect, but also because you don't have the various signals saying there's damage, you don't get inflammation and therefore not fever. Admittedly, that is a very crude and very brief overview of the method by which it works in both regards, but in general, both do a very similar thing. In terms of why it is an essential medication, well, it is readily available, it is very cheap, it's very easily made, and it doesn't require a doctor to prescribe it, but despite all of this, it is very effective for what it does, mostly pain relief and analgesia, but also fever reduction or an antipyretic. As such, there is good reason why it is so essential. After all, it's a medication that does a lot of heavy lifting for something that isn't seemingly very much at first glance. Thank you for watching this video. If you have found it interesting, consider sharing, liking, and subscribing. And please do post any comments, questions, or suggestions you have below.